Presenting on behalf of Medicine 5 and my topic name is called Untitled. So presenting Mr. X, he is a 44-year-old gentleman. He presented to ED with history of one episode of generalized tonic-clonic seizures. So he was apparently well till around 9 o'clock in the morning when he accidentally mistook eucalyptus oil as cough syrup and has consumed 5 ml of it. After which he didn't complain of any burning sensation after consumption, but around 30 minutes after post-consumption of eucalyptus oil, he complained of lightheadedness, following which he was found to have generalized tonic-clonic seizures involving all the limbs, which lasted for 4 minutes. There was history of uprolling of eyes, but there is no history of any bowel bladder incontinence, and there was history of tongue bite present with minimal bleeding. He had, following which he had post-ictal confusion for 2 hours, following which he was brought to ED. Otherwise, he's a known case of hypertension for 1 year. He was not on any medications. So when he came to the ED, he presented with, he was tachycardic at the time and his blood pressure at the time was noted to be 200 over 100. Otherwise, rest of the general and systemic examination was normal. Fundoscopic examination was normal. When he came to the ED, his sensorium has improved and his CNS examination at the time was unremarkable. So initial differentials that we have considered because his blood pressures were high, we have considered possibility of an hypertension emergency. However, fundoscopy didn't show any retinopathic changes. The other thing is we have considered possibility of an eucalyptus oil toxicity. The other thing is we also consider metabolic causes, stroke, and any adult onset seizures. So in view of that, we have done a CT imaging. It didn't show any, in fact, it didn't show any hemorrhage. And all the metabolic workup was normal. He had acidosis at the time of presentation with a lactates of 12.2. So, and hence we have considered possibility of an eucalyptus oil toxicity because of the history of consumption of eucalyptus and presence of metabolic acidosis, and which was easily recovered. So I'll talk about eucalyptus oil toxicity. Now we already know that eucalyptus oil is something that is most commonly available, and many of the local people also consume eucalyptus oil or use topical application for various lesions. So it is a volatile hydrocarbon which has a rapid action, and it is usually used as a decongestant or expectorant for cough and cold. And the toxic dose of it is 4 ml and fatal dose is 30 ml. It has a, like I said, it has a rapid action. So the action will begin within 10 minutes of injection to even 4 hours. And the mode of, intake can even be injection, inhalation, even topical application can cause. Now, eucalyptus has an active component, which is an eucalyptol, which is the one that can causes seizures. So the target organs involved are the CNS, respiratory system, and also gastrointestinal system. So gastrointestinal symptoms, they can present with burning sensation in the throat. They can present with abdominal pain, vomiting, and diarrhea. And respiratory symptoms, they can present with the bronchospasms and pulmonary edema. Whereas CNS, they can present with, if it is a mild, it can present with vertigo and ataxia. And if it is severe, they can present with seizures, loss of consciousness, and even coma in some people. So, and it can also cause cutaneous after topical applications like itching and redness. So how do we treat a patient who has come to us with eucalyptus toxicity? So we do not have a specific test, but then general urine examination for any toxic components will reveal an eucalyptus oil because of the excretion, but it is not usually done in settings. But whenever a patient comes to eucalyptus oil with eucalyptus oil toxicity, there is no specific antidote, and the management is only supportive and symptomatic management. That is, we start the patients on anti-epileptics initially, and for acidosis part, we'll start on bicarbonate infusions or bolus doses. Other thing is we can all, if the patient, sometimes the patient can come with bronchospasm, or they can come with coma, so which will require intubation or nebulizations. Because it is a gastric irritant, we should never do a gastric lavage, or we should never induce vomiting, as it can worsen it. And in severe intoxication cases, and we can also, there were studies showing that peritoneal dialysis and hemodialysis can be beneficial. Now, this is an, there are few case reports that have been published. but it is most commonly seen in children because the children are more exposed to it, and even a small amount of it can present. But there are certain cases where adults can accidentally or by injection of large amounts can present with eucalyptus oil toxicity. So here there's a report where they're showing two adults between the age of 30 to 60 has a history of accidental eucalyptus consumption, post which they have presented to the ED with the reduced sensorium and were intubated. Here also they were treated symptomatically with anti-epileptics and bicarbonate infusion. They were extubated in 48 hours and were discharged in 3 days. So this is another study showing how dialysis and mannitol has been helpful in only one patient with who has presented with severe toxicity following which they had coma. And so they have done a dialysis for this patient, following which they had symptomatically improved and was extubated. So we do not have a clear history because people do not assume that eucalyptus oil can cause seizures. So they do not historically may not tell that they have eucalyptus oil consumption. So that is one thing that we have to definitely ask. The other thing that can present with a similar presentation would be camphor or other essential oils can also have the similar presentations. So even our patient has presented with only CNS toxicity. There is no cardiac involvement. There is no cutaneous manifestation. There are no GI manifestations, and he had metabolic acidosis. So we have started the patient on epileptics with bicarbonate infusion and IV fluids, and this is 48 hours during ward stay now, and he didn't have any further symptoms, and his GCS was improved at the time of presentation itself. So I have looked at multiple articles to see for how long they have given the anti-epileptics. There is no definitive duration of anti-epileptics. Based on the symptoms, they have given it over from 2 weeks to 1 month. However, I could not find any article for definitive duration of anti-epileptic for this patient. So whenever patient has come to us with seizures, one other thing that we have to keep in mind is that there might be an exposure to eucalyptus oil, which people might not say. So that's something that we should ask and how we treat the patient. Thank you.
Yeah. Okay. So in this, you already knew what the patient had taken, is it? They told you.
They told us.
So few the things you already mentioned. So in general, if somebody comes with a toxidrome of seizure with an unknown substance intake, so what all things you should think about?
So at that time, we can also consider possibility of benzodiazepines, which are any other sedatives which can cause precipitate seizures. So the benzodiazepines are the most common, but amitriptyline can also cause. So TCAs and benzodiazepines.
So consider everything. Toxidromes following. So basically, what I'm asking are what toxins can cause seizures. So it includes drugs and other things and other poisons. So like what? So you can enumerate, and numbers are there.
Like I already said, antidepressants, benzodiazepines, alcohol, and
alcohol, will it cause seizures?
It can cause alcohol withdrawal seizures. So abstinence from alcohol for 72 hours, they can present with alcohol withdrawal seizures or alcohol related seizures if they present within 6 hours.
There are many things. No, others can tell what the toxins coming with seizures. Huh? We trust common ones. Common ones you should tell first. Commonest you see. Sorry? Zinc phosphate. What about pyrethroids? Pyrethroids, no? Pyrethroids come. What about organochlorides? They come with seizures sometimes. Okay. So, but obviously those are toxins, poisons. Usually you will have history of poison intake. If you don't know the substance, then this is all you should think about. What are the substances which comes with toxidromes of seizures? How does benzodiazepine is used in management of seizures? No? So,
but it can also
somebody else can say why would benzodiazepine precipitate seizures? Sharon? You said
Yes,
benzodiazepines.
I mean,
That's correct, actually. So, but we use it for management of seizures, right? Refractory seizures, you give in continuous infusions of benzodiazepines. How do they precipitate seizures? Tricyclic antidepressants, like you said, can cause seizures. So I actually interesting. So I actually was going to ask, what are the other similar substances, but you already put up in the slide. So I have I once had one patient who had consumed something and came with seizures. So we're wondering what he had consumed, and he had actually consumed a lot of camphor with intention of DSH, and he presented very similar case. Okay, any other questions? All right, sure. Shall I wrap it up? Okay, thank you for all the presenters. Okay, I think all of you did well, but I have to choose somebody. I think this I give it to Namrata.